right, folks. Dr. Ben here. Welcome to the Dr. Ben and Friends podcast, where together we put the med in comedy. Med in comedy. Today we're celebrating healthcare heroes and pro comics who help make our lives healthier and funnier. My guests today are orthopedic traumatologist Dr. Kate.
Hello. Thanks for having me.
And filmmaker, writer, comedian, musician Seth Hayes. Ready for What the Heck? All right. This segment, What the Heck? Dr. Kate here is going to show Mr. Seth here a word that she uses every day in the operating room. And Mr. Seth is going to pronounce the word and tell us what he thinks it means. And we're going to play What the Heck? So Dr. Kate uses some cool tools in the operating room. She's like a carpenter sometimes.
The bone constructor.
The bone constructor.
Yeah, I mean, that's a actually true statement.
All right.
Factual and funny.
Yeah.
Jason Stratham and I'm the bone
It's
constructor.
actually really fun when I actually work on carpenters and they're like, yeah, I get it.
They get it. All right. Today is special. Dr. Kate here uses really cool tools to help patient. Today, these words and terms relate to her tools and instruments. All right. Are you ready for your first word?
A whirly bird.
Whirly
Okay.
bird. Is this a real instrument?
I mean, I would
Is she making
assume
this up?
so.
Okay.
I would assume it is because like
That
I feel
sounds
like
made up.
I mean, everything's made up.
Yeah.
All words are made up.
Is that someone's name? Another eponym?
So whirly bird. I mean, I'm assuming it twists onto something, or at least twists something together.
Mm-hmm. Mm-hmm.
That's all
yeah.
I
I mean,
guess.
you know what? I'm like almost going to give that to you.
Let's give it to him.
So yeah, it's a very specific instrument that is used when you're trying to do kind of like percutaneous fixation of oftentimes a tibia. So you're making a small incision to put this really big, long plate down the side of the tibia. And sometimes the shaft may be a little bit, the angle is just not right.
Okay.
So you put the whirly bird in, and what you do is you drill through the plate and then through the bone, and then you twist the drill segment, and it pulls the bone towards the plate to get it back in line.
Such a fun sounding word for such an awful sounding procedure.
Yeah.
Does
But
the whirly
essentially,
bird-
it's a percutaneous way to, again, reduce the bone or get it back to where it needs to be.
And here I thought it was that thing that you ride at the carnial that sticks you to the wall
I know.
as it's spinning around.
It also
It should
still
be.
might be that thing.
Do you think the whirly bird gets
gravitron?
the worm?
I would, I think it's more into crickets.
Okay.
Yeah. Because I feel like the whirly bird's going out like right at sunset.
Okay.
So it's like, yeah, we're going out. Like,
Yeah. Opposite of the early bird.
Exactly.
Is the whirly bird.
It's got glitter on it.
glitter and rhinestones.
Is the whirly bird. All right.
Yeah.
We have another word here for you. Ready, listener? And
It
Mr.
is.
Seth?
A giggly saw.
Oh.
Or is it jiggly saw?
It is jiggly saw.
Okay.
Ah.
But as a
It's like the
comic,
GIF
you're
versus GIF.
allowed to call it a giggly saw.
giggly.
It sounds
Yeah.
more fun.
Giggly.
It sounds like it'd make you laugh or shake.
Yeah.
Yeah, it's a saw. It cuts through things.
Sure
probably bone.
Mm-hmm.
Okay.
Yep.
Any particular type of bone that it cuts?
It does all bones.
All bones.
Yeah.
It's an equal opportunist saw.
Yeah, I personally don't use these very often. I don't know if you use them very often. I would
not
say,
She prefers the ones that make you laugh, not the ones that make you jiggle.
right. But it's essentially like a hand saw.
Okay.
It looks like a metal rope, essentially.
Yeah.
And you go back and forth.
Maybe in amputations or... Oh, no.
I guess maybe in like the 1800s. But oftentimes it's used, I think our recon friends use it a lot in trying to get like well cemented or well fixed stems out of femoral canals. So,
Wells and canals. Like,
yeah,
right.
Yeah. So it's kind of a less invasive
A lot of water
saw.
in surgery.
Yeah.
Giggly saw. I like it. Giggly.
Yeah.
All right. All right. Next we have...
A femoral distractor.
Oh.
I mean, clearly, this is when you need to sneak up on a bone and you need to make it look in another direction and be like,
Look over
I
here.
gotcha.
Yeah.
La smoke and mirrors. Look over
Very
here, femur.
close. Yeah. You're not broken. You're fine.
What is the femur? What bone is that?
That's a leg bone. That's the big leg bone.
The big
leg
That's-
bone.
That's the one that they say if you break it hurts worse than giving birth.
Wow.
I
Yeah.
bet men say that.
Maybe. All I know is in theory that is the most pain a human being can feel is if you break your femur in half.
That's why they need to be distracted.
Yeah,
from
exactly.
Yeah.
Yeah.
They're like, it's
From
not
the-
broken.
Yeah.
Things fine.
What is a femoral distractor?
Yeah, so it's a simple machine is kind of how I would describe it. So
Okay.
you take these big pins and you put it, I tend to use it when I'm doing tibial plateau fractures or when I'm doing acetabulum fractures.
What's the acetabulum?
Is the hip joint. So
Okay.
the cup of the
cup
hip
of the-
joint. So sometimes when the hip joint breaks, a piece of the joint actually gets stuck inside of the joint. And so I use it to pull the hip joint or distract the hip joint. And so you put one of these big 5 millimeter pins in the femur, one into the kind of the higher end of the pelvis. And you kind of lock everything in, and then you just spin a wheel using, I call it a hockey stick.
Nice.
Because
Naturally.
it looks like a hockey stick.
She's a professional hockey player, folks.
But
Former.
it's essentially a threaded rod, and you're just spinning the rod, and it's bringing things open. So it's a very powerful, simple machine.
Okay.
Because it takes a lot of force to distract a hip, and it just allows it to hold there. You can look inside the joint. You can use a clamp,
Yeah.
perhaps even a burlisher clamp, to get in there, grab a piece, wash it out, and make sure that you're not missing anything. So.
Okay.
A lot of times, I think for this one, originally, like the femur bone, if it's broken in two pieces, will be shortened or overlapping. And to try to get them to where they need to go, you'd put a pin on either side and distract or pull it apart so the two pieces.
That sounds horrible.
So,
That sounds so
Yeah.
painful.
Yeah.
Good thing you're sleeping
you
during
wouldn't know.
it.
Yeah,
Thank you,
you're asleep.
anesthesia.
Yeah. Yeah.
All right.
Okay.
Do we have another word for Mr. Seth?
Got it.
Mayo scissors. I'm assuming these were created by the clinic or by the sauce.
Right.
We'll go
The
with sauce.
salad
Yeah.
dressing Hellman's folks.
Yeah. And I mean, I guess this is what you use to like, because I don't know if people know this, but when you squeeze mayo out of the tube, it comes in one long tube. So you got to
Cut.
scissor it out, cut
Yeah.
it in segments.
Yeah. Yeah.
Get
So
that Kewpie cut.
do you use these at lunch or in the operating room?
Yeah. All day long. All day. Mayonnaise is an all day affair. Yeah, they're just scissors. I guess just
Okay.
like everything in the operating room has to have like a name,
Yeah.
but it's because there's different types of scissors.
Yes.
So these are like
There's
your
safety
suture.
scissors.
Yeah,
There's
these are
cooking
your
scissors.
suture cutting scissors.
Okay.
Not to be confused with the Tenonomy's scissors.
Okay.
Not to be confused with the Metzenbaum scissors.
many.
Not to be confused with the bandage scissors, which are the ones where you
Bandage,
take the drapes
iris,
off.
listers, so many
Okay.
scissors.
Yeah, yeah.
And they're
So-
straight and curved
Yeah,
mayo scissors.
Yeah,
Okay.
yeah.
Just
so
to
we-
confuse things.
Nice.
So,
So.
hey, a guy threw a jar of mayonnaise at me the other day, and I looked at him and said, "What the hell, man?" So, mayo scissors. All right.
Funniest man in Nashville, y'all.
Listeners probably like, how did he win? It wasn't material like that, listener. How did? Must have been a slow
All right.
competition day.
Yes.
All right, we have another word for Mr.
Speaking of
Seth.
the million types of scissors we have,
Oh, here we
there's
go.
another option.
The Debakey forceps.
Okay,
Yeah.
Debakey.
These are
Household name.
These
really?
are when you've gone through a debacle.
Okay.
and you've got one of those, oh, what are they? The praying mantises and their forceps are you're in the debacle because you're in the forceps of the praying mantis and he's eating you.
Yeah.
I
Or
like
she.
it.
Yeah.
The
Well, they're-
debacle.
I kind of might start calling them the debacle.
Debacle. I like
Yeah.
it.
Because you do use them in
If
a
you're in a
lot of
debacle.
cases when you're in a debacle. They are Debakey.
Debakey.
Debakey
okay.
forceps.
Dr. Debakey.
But they are forceps. They are kind of smooth forceps.
Okay.
So you use them to grab blood vessels.
Okay.
And cauterize them. So we use electrocautery in surgery, which so you can hold the forceps will hold the blood vessel, and your assistant can touch the back of the forceps because it's all conducting through your forceps.
Okay.
Can touch the back of your forceps. So if you're in a really deep hole, like you're not going to get the electrocautery all the way down there.
Okay.
You can grab it with the forceps, and then they can cauterize the blood vessel for you.
See, I prefer Debaker biceps because those bakers,
like
they
it.
got big old
Yeah,
biceps.
yeah.
They got to move so much dough around.
But then again, to the point of the scissors, like there's 800 different types of forceps. So you got your Adson, you got your Bonnies, you got your rat tooths, you got all sorts of different.
Nice.
So yeah, we use in surgery this instrument called a bovie. I don't know if you've heard of the bovie, but it helps kind of seal tissue and stop bleeding and stuff.
Okay.
And so interestingly, when I first met my wife, she was most impressed by the way I used the bovie. And I know it doesn't sound like a lot, but that's actually how I cauterize.
Ha ha ha. There we go.
Did you just
my
come
use
up with
of
that?
the
or is
bovie
that-
was how I cauterize. Okay, what do we have next?
All right.
Nashville's Funniest Comic, please.
So this will probably be good for
All right.
this will probably be good for the last one here.
Intramedullary. Oh, I almost had it. Intramedullary nail. Okay. So clearly this is, so intra is within instead of inter, because intranational is within. So clearly this is a
Intramurals.
nail that is supposed to be within a bone, I'm assuming.
Mhm. Very good.
Okay.
Yeah.
Okay.
So bones are hollow.
Yes.
It's called the medullary canal.
Filled
is
with
the-
marrow,
Yes.
the tastiest part of the cow.
Yes. Yeah. I know a lot of people, actually, I've had patients be like, well, isn't that where all my, because I tell them, I'm going to put it down
Yeah.
center of their bone. Isn't that where my, all my blood vessels or my blood cells are made? I'm like, well, yes, but no.
And you
Your
have other
spine-
bones doing
yeah,
that
your
too.
spine actually does a lot of the
there
blood
are
cell
other
production.
bones.
But yeah, so this is a titanium rod that goes down the center of your bone.
Okay.
Usually with a femur, tibia. You can use them in the
Long bones.
yeah, and the humerus as well. And essentially, it holds the bone in place while it's healing.
Okay.
So it's really probably one of the biggest technology leaps in orthopedics. Actually, it's a really interesting story. So Germany was the first country to actually create intramedullary nails. It's called the Kuncher nail. And so we had soldiers coming back from, being prisoners of war.
Yeah.
And they were found to have these rods in the center of their bones. And a lot of people thought it was torture devices, when in fact they were just trying to help them out.
Yeah.
But essentially, instead of keeping patients in bed traction, which means you have either a pin in the part of your femur, it's called skeletal traction, or a specialized boot on your leg
Yeah.
that's holding weight off the end of the bed to keep your bone out to length and in line. Used to treat people for 6 weeks like that.
Wow.
All right. When these,
Can you imagine?
6 weeks. And now you put one of these intramedullary rods in or intramedullary nails, the patients can walk that same day.
So I actually have a friend who got hit by a car back in September,
Mhm.
and I'm pretty sure she had some of those put in.
Yes.
Yeah.
Yeah. And, I tell people they're not going to want to run a marathon tomorrow.
Yeah, but at
Not
least you
that
can
they ever
walk.
did, but
They
getting
can-
people up and out of bed.
Yeah.
Weight bear right away.
Yep. And kind of away from the risks of being supine for long periods of time. You worry
Yeah.
about skin issues, pulmonary issues.
Atrophies. Yeah.
And really, really,
Blood
really
sores.
important in our elderly folks that
Oh,
we get
sure.
them up immediately after surgery. So,
Yeah.
Dr. Kate, tell the listener, how do you get a nail inside a bone? They're probably wondering.
yeah.
Is this like some magic trick, or
Yeah, kind of.
you have to use a distractor?
Yeah.
Like, don't look over here.
Yeah. Yeah.
I'm gonna-
So
For my next trick.
yeah. So we make really small incisions actually. So I probably make, if I'm putting a femoral nail in, 3 centimeter incision, kind of up by the flank buttock area. And what you do is you start with a starting wire. All right. So you get it at the correct start point. I'm not going to go into that, but you take your time. That's one of the most important part of the cases is getting the correct start point. And then you use what's called a reamer to open up the bone to get access into the canal. You put what's called a ball-tipped guide wire down the center of the bone to the correct end point. So correct starting point, correct end point. And then you open up the center of the canal a little bit with what are called reamers. And what that does is it takes, let's say, maybe your canal was 9 millimeters, and I'll open it up to about 11 and a half. That allows you to increase the diameter of the nail that you're putting in, which increases the stiffness. And in certain nails that we use, allows you to use bigger interlocking bolts, which are the bolts that the patients are actually walking on while the bone is healing. And so, yeah, you ream to the size that you want, usually about a millimeter and a half above the planned size of the nail. And then you put the nail over the guide wire and you use the mallet and you whack, 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 whack until it is in the correct position. And then you lock it proximally with some bolts, lock it distally with some bolts, and that allows people to walk on it.
There we go.
Wow.
Yeah, easy.
Yeah, so this is going all the way from your top of your hip to your knee, essentially, down by
Yeah.
your kneecap
Ugh.
through little incisions.
It's a long nail.
It's, I would say for an average adult male, it's between 400 and 420 millimeters.
Wow.
Perfectly average.
Yeah.
Whereas if you were to do that with like plates and screws, it's a bigger incision. They can't walk on it necessarily right away.
Yeah, I mean, if you have to, and there are certain scenarios, like let's say a patient has a total hip, and you're not able to put an intramedullary nail in, you're making an incision from their hip to their knee, and kind of, the risks that come with that versus a 3 centimeter incision and then several 1 centimeter incisions to put those interlocking bolts in.
Wow.
So,
Wow. So
Incredible.
and you did a great job with the pronunciation.
Thank you.
Yeah.
Amazing. A lot of people in the medical field have struggled pronouncing these words.
Yeah,
Like
yeah.
during the timeout,
yes.
I hear a lot of variations of,
Yes.
wait, what am I doing again?
Yeah, I'm like, I don't know. That
Like-
doesn't sound like what I'm doing.
Look, my philosophy with everything is fake it till you make it. If you
That's
say
right.
anything with enough confidence, people will be like, that's really good.
Yeah.
It's wrong, but that was really good.
Yeah. Like I said, I'm going to use the debacle probably.
There you go.
Debacle. All right, folks. That was What the Heck. How did you do? Did you know any of those words, listener? All right,
I
folks.
sure didn't.